Good afternoon, and we have with us Dr. Anand, critical care specialist at Choitram Hospital, Indore. We welcome you to Natco Pharma Specialty Criticon 2024 studio.
Thank you.
We look forward to your advice for the young generation doctors, and especially in the care of critical care, which is associated with antibacterial resistance. My very first question is, how do you foresee the changes in the critical care management?
See, earlier when the critical care has not grown so much, it is the clinical acumen of the doctor which decides about the treatment. Now, with the upcoming gadgets and with more armamentarium in the form of novel molecules, newer antibiotics, with the kind of bacterial resistance which we are seeing in the ICUs, the critical care has changed a lot over a period of time, probably a decade. So now, just like ultrasonography is a new stethoscope for the intensivist, and we do the bedside diagnosis of various things and acute diagnosis of the acute diseases. In similar way, because of the developing antimicrobial resistance, a lot of antibiotics, usage of antibiotics has been changed. We have to start with the broad spectrum antibiotics upfront in a severe patient with multi-organ dysfunction.
Great. What is your advice to the young ICU doctors to enhance patient care?
Develop your own clinical skills. Number one, don't believe on gadgets too much. You have to be master of your gadgets, not to be the slave of your gadgets.
Very, very interesting point. Yes, gadgets are really creating an issue, but thank you so much for that insight. And
And use antibiotics wisely.
what is the prevalence of carbapenems producing bacteria in your practice, and which is the best treatment option?
See, nowadays, this is the major hurdle in the treatment and the outcome of the patient. We are seeing a lot of carbapenemase resistant bacteria in the ICUs because of the overusage of antibiotics. So, one has to be very much concerned about these deadly bacteria. And the treatment for that, then you have to use the combination therapy for that. We have a normal molecule like ceftazidime avibactam, which has now been introduced in the last couple of years back, which has played a very important role in dealing such kind of dreaded infection.
Great. Dr. Sangi, we thank you so much for your time here at the NATCO Pharma Specialty Criticon
Thank you.
studio.
Thank you so much.
And thank you for your insights,
Thank you.
especially the advice to the young doctors. We wish you all the best.
Thank